Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive Physical Therapy, where we rehab your mind to revive your body. You've clicked on this video because you think you have hip bursitis. Well, I'm going to tell you why it's a lie. Liar! And how to fix it next. So you've got pain in the side of your hip, you got pain in your groin, you got pain in your lower back. It's all hip bursitis? I refuse to believe that. And I talk about this at length. I have a big distaste for the blanket diagnosis or the very general diagnosis of hip bursitis. Just drives me crazy. What does it mean, hip bursitis? The bursa is actually a sac that helps provide some cushion, and it's itis, it's inflamed, bursitis, and it's in your hip? Okay, that's all I need to know. But why is it inflamed? That's the key. That's what we got to answer. And I've spoken this on some other videos at length, that it's all about being unstable. This hip is unstable. Now we need a stability exercise to help this instability. You got a stability issue, stability solution. So we've got a great exercise called hip setting. Stay tuned and we'll talk about that next. All right, we're gonna set up this hip setting exercise. You need a couple things. You need a belt, yoga belt. You could use a regular belt or a towel, but I prefer a yoga belt because it's firm, sturdy, nothing stretchy. You need to be able to pull on it a good amount. And then you need a footstool or the first step of your stairs, because I'd hate for you guys to be on the last step of your stairs up there and fall on your way back if you happen to lose your balance. First step, keep that down. We want to set it up in a staggered stance, and so there's a couple ways we can put this strap. One way is underneath the foot or midfoot. Some people like that feedback in their foot so they can kind of press into this stool, which is essentially then attached to the ground. That's our goal for that stability. Or the way we've done in previous exercises is just right behind the thigh. I personally like it back here, but I want to show you guys the other way, so that way we do it effectively. So if we kind of situate ourselves in this position, then I want you to look at where my weight is redistributed, or where my weight is distributed. It's 100% is the total. And so right now 70% is back here, 30% is in the front. As I continue to drive and use this exercise, I'm actually doing two vectors here. My butt is going down, and my foot and my foot is also going down, but I'm pulling up. So I'm doing this. So I'm going up one direction, down one direction, and this is driving my natural weight shift towards the 50, 60, 70, 80, 90% into the front leg. Our goal is to get to 100% in the front leg, and that is where you are fully standing with one leg on the stool or the stair. So let's get to it. So I'm gonna pull up, and just remember that I'm constantly pulling up. So you're gonna hold this until the shakiness stops. So if you're shaking at 30% in the front and 70% in the back, you gotta start here. Because if you do 50%, you're also gonna be shaking if you're not ready. So this is a progressive exercise, all about progressing to the next 10% or 5% if that's too much of a jump. So you wanna keep driving it down. So I'm gonna drive that down at 30%. Once that shakiness is and once again, this vector is going down, I'm pulling up. So here's 40% in the front, 60% in the back. You got 50-50. This is about 50-50. So if you come by, try to knock me over, I can still use the other leg. 60% here. And then once you get to 70%, your back hind leg, your heel starts raising up. So at about midfoot, it's 80%. 90% is when you're on your big toe. Now here's the most important part when you get to 100% and you're getting the lift off. You're essentially, this is in the middle, but you're having two vectors, almost like that recycling logo. You can go this way. So one arrow goes this way, one arrow goes this way. And that's what, it's like a crank. So we're gonna drive that. So I'm on 90%. And as I get there, I am cranking to get here, and then up. versus what a lot of people do will they're just trying to stand up. And that's incorrect. Looks very different. Actually, it's harder on your knees. This is all about driving your hip and getting it stable. So let's look at this again from the beginning. So once you get really good at it, it's actually pretty quick, but you can pull up. Remember, I'm pulling up at all times. I'm fighting against my own weight. So this is 30% in the front, 40, 50, 60, 70, 80, 90, 100, like that. And I'm continually pulling up. I don't want to forget that. That's going to be the goal, to making this leg or this limb more stable and avoid rubbing against your bursa and getting that bursitis or that instability feeling that many people have. So hopefully with this hip setting exercise that you've improved on your hip bursitis. Oh, I just get chills when I see this diagnosis. Really should be whoever's given that diagnosis has a brain-itis or something like that. So, you know, it's an instability problem. Let's just get it in our heads. It's an instability problem. We need a stability solution. And if you benefited and you found some resolution to your bursitis pain, and you can move up, you can pull up your pants a little bit better, you can climb the stairs, up and down the stairs better, that's great. We love to hear your feedback. So leave those below. And then these guys, we love them. We definitely love those. And then if you haven't supported our channel before, please subscribe. We love that support. We check it every day, every hour, every minute, like dying I keep hitting refresh, hit refresh for the next few subscribers. It just makes me feel warm. So thanks for your support. I'm Dr. Lin. Remember, we heal smarter, not harder.